Welcome. This presentation is about how social and cultural factors influence psychiatric disorders, especially in India. This presentation is a part of academic on the course Clinical Assessment and Diagnosis of Psychiatric Disorder. Culture and psychiatry are closely linked. Every society has its own beliefs about mental illness. These beliefs affect how people experience mental health problems and how they seek help. For example, hallucination might be considered as a sign of possession in India, but in Western countries they are seen as a symptom of schizophrenia. Understanding culture. Culture means the total way of life, how the people think, live, believe, and they behave. It includes languages, religions, customs, and traditions. It guides how people understand the world and responds to stress or illness. So, culture shapes our thinking, behavior, and values. It is passed down from generation to generation and affect how the people view their health, their illness, and their life in general. Culture and mental health. The culture plays a major role in shaping the mental health and illness. It affects how the symptoms are expressed, understood, and treated. So, culture influences both the disease process and also the healing process. Cultural influence on psychiatric disorder. All culture have mental illness, but the symptoms may differ from different culture. So, the beliefs influence how the people describe their problem. Mental illness will appear everywhere, but how the people talk about them is different. In India, we might say that they are possessed by a spirit, while someone in the western part might say machines control their mind. Here we can it is clear that mental illness exists in all cultures, but the symptoms are described differently. Cross cultural understanding of mental health. Ancient cultures like Indian, Chinese, Roman had similar ideas, all linked mental illness to imbalance in our body or mind. Even the ancient societies believed mental health was about the balance, that is, the balance between the body, mind, and spirit. This shows concern about the mental well being is universal, that is, it is not limited to one culture. Mental health in Indian culture. In Indian texts like the Vedas, Upanishads, it talks about the mind. Focus on balance between the mind, body, and soul. So India has studied the human mind for thousands of years before. Ancient writings about the thoughts, emotions, and a way to stay mentally healthy through yoga, meditation, and self control. For example, this yoga and meditation are used to reduce the stress and also to prevent the mental illness, showing the importance of the mind and the body balance. Then, socio-cultural factors in India. Religion, family, and society will influence the mental health. In India, mental health is affected strongly by the family bonds, social expectations, and the religious belief. But the stigma and the lack of awareness stop many people from getting the proper treatment. Um, we can see that someone with depression may hide their sadness to avoid shame, or families may prefer spiritual healing before medical care. A stigma exists in our nation. Urbanization and mental health. The rapid urban growth and migration causes mental strain. City life increases the stress and loneliness. It leads to depression, alcohol use, and anxiety. The people living in crowded cities faces job pressure, social isolation. It increases the risk and rise of mental health problems. A man who is moving to a big city may feel isolated and develop alcohol dependence. This shows how the social environment affects the mental health. Presentation of symptoms in different cultures. An example from India is given here. People from different culture express mental problems differently. In India, people may complain about the headaches or stomach pain instead of talking about sadness or anxiety. Culture affects how illness is felt and described. Culture changes how people show mental distress. Cultural bound syndrome. Some disorders occur mostly in certain cultures only. For example, that syndrome and possession states in India. That syndrome means anxiety about the semen loss, which is common in Indian men. Possession state means patient hear voices and believes spirits control them. These are cultural ways of expressing stress or mental illness. Here, certain mental disorders are tied to cultural beliefs. Cultural aspects in psychotherapy. In Indian culture, healing involves emotional guidance and wisdom. The therapist helps like a teacher, offering advices based on both the science and cultural values. This makes therapy more meaningful for Indian patients. For example, a therapist may use meditations inspired by the cultural text along with the counseling. This helps patients trust the treatment and accept the change. So, in summary, the culture affects all part of the mental illness and treatment. Mixing the traditional and modern ideas helps a better care. Culture shapes how we experience and understand the mental illness. The social and cultural factors strongly affect our mental health. Cultural understanding leads to better healing. Respecting traditions and beliefs is key to improving the mental health outcomes in India. Thank you.